Lifestyle diseases. We have a choice between nurture and neglect. To nurture our life through a healthy lifestyle, or allow an unhealthy lifestyle to lead us into decline. Some of us do follow the path of decline and have become or might become victims of lifestyle diseases associated with the way we live. Do we knowingly carry this burden? How does an unhealthy lifestyle slowly take its toll? Some lifestyle diseases include atherosclerosis, heart disease, and stroke, obesity, type 2 diabetes, some types of cancer. Take a look at the risk factors for some lifestyle diseases and the strategies for their prevention. Atherosclerosis occurs when the blood vessels, arteries, that carry oxygen and nutrients from your heart to the rest of your body become thick and stiff, sometimes restricting the blood flow to your organs and tissues. Atherosclerosis can lead to serious problems, including heart attack, stroke, or even death. Heart or cardiovascular disease results from damage to the heart and blood vessels. Some risk factors are high cholesterol, hypertension, diabetes, obesity, mental stress. A stroke occurs when the blood supply to part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and nutrients. Within minutes, the brain cells begin to die. For atherosclerosis, heart disease, and stroke, first, don't smoke or use tobacco. Chemicals in tobacco can damage your heart and blood vessels, leading to atherosclerosis, narrowing of the arteries, which can ultimately lead to a heart attack. Second, exercise for 30 minutes on most days of the week. Physical activity can help you control your weight, can reduce your chances of developing other conditions that may put a strain on your heart, such as high blood pressure, high cholesterol, and diabetes. Third, eat a heart-healthy diet. A diet rich in fruits, vegetables, and whole grains can help protect your heart. Beans and other low-fat sources of protein and certain types of fish can also reduce your risk of heart disease. Try to keep saturated fat to no more than 10% of your daily calories and avoid trans fat, that is, synthetic foods. The major sources of saturated fat include red meat, dairy products, coconut, and palm oils. The sources of trans fat, that is, synthetic foods, include deep-fried fast foods, bakery products, packaged snack foods, margarines, and crackers. 4. Maintaining a healthy weight. Being overweight, especially if you carry excess weight around your middle, increases your risk of a heart disease. Excess weight can lead to high blood pressure, high cholesterol, and diabetes. How to maintain healthy weight? Follow a healthy diet, and if you are overweight or obese, reduce your daily intake by 500 calories for weight loss. Stay physically active. Limit the time you spend being physically inactive. 5. Get enough quality sleep, at least for 7 to 9 hours. People who don't get enough sleep have a higher risk of obesity, high blood pressure, heart attack and diabetes, and depression. If you feel like you've been getting enough sleep but you are still tired throughout the day, ask your doctor if you need to be evaluated for sleep apnea. 6. Get regular health screenings. High blood pressure and high cholesterol can damage your heart and blood vessels. Regular blood pressure, cholesterol, and diabetes screenings can tell you what your numbers are and whether you need to take action. Obesity is a complex disorder involving an excessive amount of body fat. It increases your risk of diseases and health problems such as heart disease, diabetes, and high blood pressure. How to prevent obesity? 1. Exercise regularly. 2. Consistently follow a healthy eating plan. Focus on low-calorie, nutrient-dense foods such as fruits, vegetables, and whole grains. Avoid saturated fat and limit sweets and alcohol. Eat 3 regular meals a day with limited snacking. 3. Know and avoid the food traps that cause you to eat. Identify situations that trigger out-of-control eating. 4. Monitor your weight regularly. Type 2 diabetes is a chronic condition that affects the way your body cells convert sugar into energy. If you have diabetes, no matter what type, it means you have too much glucose in your blood, though the causes may differ. Too much glucose can lead to serious health problems. Here are some lifestyle risk factors for type 2 diabetes. Weight. Being overweight is a primary risk factor for type 2 diabetes. The more fatty tissue you have, the more resistant your cells become to insulin. However, you don't have to be overweight to develop type 2 diabetes. Inactivity. The less active you are, the greater your risk of type 2 diabetes. Physical activity helps you control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. High blood pressure or treatment for high blood pressure. A history of heart disease. Low good cholesterol levels. High triglyceride levels. Type 2 diabetes prevention strategies. Get more physical activity. Research shows that both aerobic exercise and resistance training can help control diabetes. But the greater benefit comes from a fitness program that includes both swimming, cycling, walking, dancing. Lose excess pounds. Participants who exercised regularly reduced the risk of developing diabetes by almost 60%. Get plenty of fiber such as fruit, vegetables, beans, whole grains, nuts and seeds. Go for whole grains, which may reduce your risk of diabetes and help maintain blood sugar levels. Skip fad diets and make healthier choices. Low-carb diets, the glycemic index diet, or other fad diets may help you lose weight at first, but their effectiveness at preventing diabetes isn't known, nor are their long-term effects. Cancer. Cancer refers to any one of a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. Lifestyle risk factors are smoking, drinking alcoholic, excessive exposure to the sun, or frequent blistering sunburns, being obese, having unsafe sex. Chemical carcinogens are tobacco. If you smoke, you are more likely to develop cancer of the lung, mouth, throat, esophagus, bladder, and pancreas. Smoking is thought to cause about 1 in 4 of all cancers. About 1 in 10 smokers die from lung cancer. Secondhand smoke also increases your risk. 90% of people with oral cancer have used tobacco. Exposure to workplace chemicals such as asbestos, benzene, formaldehyde, without protection increases the risk of developing certain cancers. Cancer prevention strategies. Stop smoking. Smoking is linked to various types of cancer, including cancer of the lung, bladder, cervix, and kidney. Chewing tobacco is linked to cancer of the oral cavity and pancreas. Avoid excessive sun exposure. Harmful ultraviolet rays from the sun can increase your risk of skin cancer. Limit your sun exposure by staying in the shade, wearing protective clothing, or applying sunscreen. Eat a healthy diet. Choose a diet rich in fruits and vegetables. Select whole grains and lean proteins. Eat less red meat and cut out all processed meat. Exercise and maintain a healthy weight. This might lower the risk of various types of cancer, including cancer of the breast, prostate, lung, colon, and kidney. Stress is a lifestyle culprit underlying emotional and physical disorders such as heart disease, asthma, obesity, diabetes, headaches, depression and anxiety, gastrointestinal problems, Alzheimer's disease. Why is there so much stress? Your stress level will differ depending on your personality and how you respond to different situations. Stress triggers include work stresses, life stresses like the death of a loved one, chronic illness, job loss, financial troubles. Fear and uncertainty, attitude and perception, how you view the world. Unrealistic expectations, a major life change. Some effective strategies to manage stress. First, pray. Instead of worrying, take everything to God in prayer. God tells us not to be anxious about anything, but instead to turn everything over to Him. Use different kinds of prayer: vocal, meditative, contemplative. Prayer may consist of a blessing, adoration, petition, intercessions, praise and thanksgiving. Prayer may use scripture, music, gesture, ritual, symbol, and silence. Second, get moving. While you get maximum benefit from exercising for 30 minutes or more, you can start small and build up your fitness level gradually. Short 10-minute bursts of activity that elevate your heart rate and make you break out into a sweat can help you relieve stress and give you more energy and optimism. Third, practice relaxation techniques. There are many types of relaxation techniques, from deep breathing and meditation to yoga and Daiki. Meditation can wipe away the day's stress, bringing with it inner peace. Learn simple meditation techniques that you can use when you need it most. 4. Laugh out loud. A good belly laugh lowers cortisol, your body's stress hormone, and boosts brain chemicals called endorphins, which help your mood. 5. Practice mindfulness. Mindfulness is the practice of purposefully focusing your attention on the present moment and accepting it without judgment. It's a program that can help you to learn to calm your mind and body, which in turn helps you to cope with illness, pain, and stress. 6. Be grateful. Grateful people tend to be more optimistic, a characteristic that researchers say boosts the immune system. Keep a gratitude journal. List the benefits in your life and ask yourself, to what extent do I take these for granted? Talk to yourself in a creative, optimistic, and appreciative manner. Frame a situation by looking at it with a different and more positive attitude. When you have an attitude of gratitude, you wake up saying, "Thank you." Reach out to those in need. When you're stressed and irritable, your instinct may be to wrap yourself in a cocoon. Instead, reach out, serve those who need your help. It will help you to feel less stress, more connected to your spirit, more grateful for what you have, and less invested in the rat race. When you focus your attention on someone else's well-being, it actually reduces your own stress levels. Lastly, sing, draw, and eat a balanced diet. Bananas can help you calm your nerves and enhance your mood. Lastly, drink in water, drink in health. According to the Institute of Medicine, an adequate intake for men is roughly about 3 liters or 13 cups of total beverages a day, and a woman 2.2 liters or about 9 cups of total beverages a day. You may need to modify your total fluid intake depending on how active you are, the climate you live in, your health status, and if you're pregnant or breastfeeding. Consult your doctor. Remember, God blessed us with life. Let us choose to nurture it.